Thanks for joining us today for our provider webinar entitled Provider Engagement, Best Practices for Sustainability and Success. So joining us today for this webinar are Dr. Junith Thompson, provider for Racine Kenosha, and also Dr. Janine Rethy, provider for Loudoun County. And we also have Natalie, who's helping us to facilitate the webinar. So we're going to go ahead and get started with the presentation. If you have any questions, please hold your questions until the end of today's presentation, as we're going to have the opportunity for questions and answers at the end of the webinar. So with that, I'd like to hand it over to Dr. Thompson, provider for Racine Kenosha.
Good afternoon. Where I am is just good afternoon. I don't know where everyone else is from, but I just want to say I'm Dr. Junith Thompson. I am a solo practitioner in OBGYN in Kenosha, Wisconsin. I am part of the KHIP coalition team, the Racine Kenosha Community Action Agency. And I'm pleased to be able to be here with you today. My involvement with the WIC program began with a patient stopping by my office and informing me about this grant that we had and the project. At the time I found out I was getting information about the WIC office that was coming to my front desk, but I never know or engaged in any of the information that was given. And after she spoke to me, I decided, oh, I wanted to really initiate and know what the WIC office does, because I had been passing by it. The WIC office is not far from my actual office where I practice, and I had been seeing the farmers market. Apparently that was every Wednesday morning as I passed by, and I wonder what's going on in there. It never became real to me until I told her, I said, I want to come for a visit to know what's going on. So I went to the WIC office and initiated and scheduled a tour of the facility. When I got there, I followed a patient from her initial contact with the staff up until the end with the dietitian. It didn't become real to me until I did this. It was amazing. I didn't realize that such professional activities were going on and the level of care that patients were getting. So this really strengthened my desire to work with the program. So as you see me mention, once I went to the local WIC clinic and saw what was offered, it became real. And now WIC has become a community resource for me to refer my patients and their families to. So as you can see in the picture, I have one of my WIC family, one of the mothers I delivered. I take really great pride in taking pictures with them and enjoying the moment. And you also can see the front office of the WIC office. It was very professional atmosphere. It gives a sense of family and togetherness. Next. Actively participate on a work team. Through my involvement on the leadership team and coalition, I've been able to offer my expertise to work team number 3, which we called a non-pharmaceutical prescription pad, and encourage patients to set healthy goals. What happened is that we had formed a coalition, and we developed 4 work groups. I'm not a very big morning person, but 7:30 in the morning we were meeting to work on setting and coming up with the prescription pad that will we can engage patients. And we finally came with this work, Eat, Move, and Thrive, Kenosha County. We want to be able to change the culture of health in our community. And we've starting this program at the beginning of the year has been very, very good because I can engage the patient and tell them what goals have you set for yourself for the new year. And it's been really interesting. I will be using this to engage all other providers to do the same. You know, the patients can really see when you really care about their health and whether you are enthusiastic about what you're offering to them. And once they see your level of enthusiasm, they really want to do and participate in the activities that you intended to them. So I have other physicians that have gotten involved. A cardiologist, Dr. Abel, has taken real interest in the program, and I have given her some of the information, and she's engaging her patients in this program. And in fact, yesterday, one of the patients came back for follow-up, and she had, her goals was set to lose weight. And we talked about how are you doing with the program, and she said it was really helpful, and she hadn't had a chance to initiate a 1-week pass at the YMCA that was given to her for free, and she is planning on doing this because she's been sick in the last week or so. So the bottom line is to engage, 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 and get communicate with the providers and try to get them to join in the efforts in making health a reality for patients in our community. Next. So outreach directly with providers. So I know it's very difficult because even myself, I find it a little difficult even to take the extra time to talk to patients about the recommendations of non-prescription, about the involvement in participating. The physicians, time is a factor, but we need to take that extra time to do and try to engage, engage, and engage. We had a community open house where we invited physicians to come in. It wasn't as successful as we wanted it to be, and we're learning every day new tricks and to talk to them and to try to engage them. Even myself, I was to come to the program, but I couldn't make it because I got busy with the hospital. I had an emergency at the hospital. But I'm not giving up. I haven't given up. I'm continuing to talk to them, and my involvement with the WIC program has helped me to really use that as a great resource for my patients and for me to help them. Because I'm not far from the office, and once I have a patient like a pregnant one who's losing weight and not gaining, I said, yes, we have resources at the WIC office. Stop by, and you have a very professional, well-qualified dietitian who can help and be a resource for me to help my patients to move to get better. You see the picture with me. This summer I got involved with the farmers market, and it was a really interesting day because there were students that came in from the elementary school. The farmers were talking to them about vegetables and the apples, and it was really an interesting event for me to get to know the farmers at the farmers market and to see the level of engagement that was going on. And the bottom line at this point is continue to work to find new ways that we can engage the providers. Encourage them to come and visit the center. go to the offices of the providers, and don't just drop information at the front desk, but the nurses are the ones that usually are at the forefront of seeing the patients first. So ask to see if you can speak to the nurse and set up an appointment, or wait to find the time to wait for the nurse to engage the nurse and give the information that we need to give to the office regarding the WIC activities and the programs that are available through the WIC office. I think that's all for me right now.
Thank you, Dr. Thompson. I'd like to turn it over now to Dr. Janine Rethy, provider for Loudoun County.
Hi, thank you very much for having me today. I'm Janine Rethy. I am a physician advisor at the Loudoun County Health Department, and I also work part-time in private general pediatrics in a small community private practice. Next slide. So a little bit about Loudoun County, Virginia. I think you can go again. So we are a rapidly growing county right outside of Washington, D.C. Our population has more than doubled since 2000. We are a wealthy county overall, with one of the highest median household incomes in the country. And we're also overall a very healthy county. Next slide. We are rapidly changing as well, and some interesting dynamics going on in our community with a rapidly growing immigrant population, particularly an Asian and Hispanic populations. Our Hispanic population has seen a 40% rise in the last decade. Although we have a sort of a small percentage who are living below the federal poverty line, you can see on this map that we have these pockets of poverty and a particularly high rate of poverty in our Hispanic population. Next slide. So a little bit about our health department. We are a district of the Virginia Department of Health. We were the first in our state to be accredited through the Public Health Accreditation Board. And we have two major divisions. One is community health, which has a clinical wing doing some sort of basic services. And then obesity and chronic disease prevention, which is where I work. We were formed about 3 years ago. We're a small team and are grant funded essentially. So we depend grant to grant to run our programs. And then the other division is environmental health. Next slide. So a little bit about our coalition. It's the Loudoun Pediatric Obesity Coalition, and we were formed officially in March 2013. Initially, it was a community advisory board from an American Academy of Pediatrics catch grant that I'd received in 2012, and that evolved into the full coalition a year later. The vision statement of the coalition, you can see here, we envision a county where all children and their families are empowered to live a healthy life by having knowledge, skills, and access to healthy food and physical activity. Our mission is to bring a diverse group of organizations and individuals in this community together to improve and sustain systems, infrastructure, and services available for healthy living for families. Next slide. Our goals are to decrease the incidence and prevalence of childhood overweight and obesity in Loudoun County by streamlining existing healthy lifestyle resources for families and identifying gaps in existing resources, improving access to opportunities for physical activity, particularly among low-income children and their families, increasing access to healthy food to make it an attractive option, and increasing access to affordable pediatric weight management services. One of the facts that I'd missed in an earlier slide to let you know is the pediatric obesity rate in the county is very high in the low-income population. So in our federally qualified health center, about 50% of the children are either overweight or obese, which is more than double the rate of the rest of the county. Next slide. So the coalition is not structured as a nonprofit, but it is a structured organization. It has bylaws, a leadership team, and committee chairs which are elected annually. It's fairly large at the moment, so more than 55 members from over 30 organizations and very sort of diverse stakeholders from the community, including us at the health department. Northern Virginia Family Services is strong, George Mason University, Loudoun Hunger Relief, which is our biggest food pantry, Connect Northern Virginia, which is a resource organization. Several of the departments from Loudoun County Public Schools are heavily involved, Safe Routes to School, Head Start, and so on, and our farmers markets as well, our federally qualified health center, insurance companies, and so on. We do meet monthly, and we have a fairly robust attendance. And it really exists as a working coalition, so there's just strong multi-sector collaboration between the organizations. Next slide. So for our team, for CPHMC, the leadership team, like everybody else, is a project coordinator. Who is Jennifer Brady. She's outstanding. I think most of you have met her. Myself as a physician advisor and a work participant. And we've also partnered on this grant with George Mason University, Department of Nutrition. Dr. Sina Gallo is a professor of nutrition who's been really an outstanding collaborator with us on this project, and others in the past as well. The Loudoun Pediatric Obesity Coalition Secretary is an active member on our team. And we also have several students. At the moment we have 3 actually, but we range from 1 to 3. Masters and practicum students from GMU and some other partner institutions as well. And our CPHMC team meets weekly. Next slide. So a little bit about my role as a physician advisor. Really, I see, primary care physicians, our core role is to provide clinical best practice in the context of a medical home, which most of us are sort of familiar with that. But really, I see that as integrating this medical home with community prevention. So understanding how and impacting really how the community affects the ability of the patient to achieve optimal health. And my model for this, I use the Prevention Institute's community-centered health homes model, and that looks really, it's sort of bridging this gap between health services and community prevention, providing benefits to the patient as well as to the community at large. And this model also really looks to empower their physicians so they can use their assets and expertise and credibility to sort of solving some of these problems. Next slide. So I wanted to kind of take you through some of our projects. The main one really I wanted to highlight is our breastfeeding project. This is sort of a community-based model that we use. Center for Social Inclusion put out this model looking at breastfeeding disparities last year, and it's really the same sort of community-based approach to health. And I'll just take you through how we approach this from sort of all of these sectors, looking at medical infrastructure, community resources, and employment policies as we try to decrease disparities in breastfeeding in our community. Next slide. So as far as employment policies, we look to introduce lactation support programs to the business community, and we created a toolkit, the Loudoun County Business Case for Breastfeeding Toolkit, and it's based on the U.S. Health and Human Services Business Case for Breastfeeding Toolkit. Next slide. So these, sorry, go back one. Yeah. So we took this toolkit and we presented it out in the community to Chamber of Commerce events, Society for Human Resource Management events, as well as meeting with individual local businesses to help them implement this toolkit. Next slide. Our biggest success has been the Loudoun County government. So they really introduced a full comprehensive lactation support program, and this was the first county in Virginia to do so in the government. The policy which we helped them to write was became effective July 1st of last year. Next slide. We also helped them to create, sorry, one back. To create educational material for the employees, which included information about how to access insurance benefits for breastfeeding. Next slide. And we helped them in how they built 2 permanent breastfeeding rooms, one in the main government building and one in an annex building. The breast pump that you see in the back there in the green box was provided by the insurance provider, which was Cigna. Next slide. We also really work to try to engage multi-sector stakeholders in the community. So we've really built a strong relationship with our local Chamber of Commerce. We sit on the Health and Wellness Committee, and we've incorporated these breastfeeding measures into the annual Healthy Business Challenge for this, actually last year, and then this year we expanded it. And those who complete all 5 are going to be getting a decal, which we've worked with the state to provide to post on their businesses. We're also active in the Loudoun Breastfeeding Coalition and worked with them to create a breastfeeding resource guide for our community. And it's sort of a larger campaign as a part of this grant have created the Live Healthy Loudoun campaign, its logo that you see here. And here's our general resource guide for the community for living healthy in Loudoun County. And it's sort of comprehensive and includes breastfeeding as well. Next slide. So the other piece of this was looking at medical infrastructure, so training for physicians. A couple of years ago, we did a study looking at healthcare providers' knowledge and attitudes and practices in breastfeeding. And then the results of that informed this toolkit that we provided for physicians, sort of going over best practices for primary care practices in our county, and distributed that to all the providers in the county. Next slide. So the final piece we wanted to look at was really looking at WIC, how our clients and our infrastructure in WIC is doing. So we completed a study a few months ago, really trying to understand sort of in a broader sense how WIC is doing with access and utilization of community resources, nutrition and physical activity, and then breastfeeding and vitamin D was a piece of that study as well. Next slide. So it's quite a broad study. I just wanted to highlight some of the breastfeeding results for you that were kind of interesting. So if you look in the red boxes, there is the breastfeeding rates that we found in our population and during the study. So these are different from WIC rates because these are de-identified anonymous results. So they're not linked to the WIC packages. So we can see they look overall pretty good. Ever breastfeeding is better than Virginia and Healthy People 2020 rates. 6 months looks good too. Our exclusive rates were lower at 3 months, 35% compared to 38 and 46 for Virginia and for Healthy People 2020 goals. The really interesting thing we found there was exclusive breastfeeding at 6 months went up, which is a very unusual finding. And so we are curious to kind of find out more about, you know, are mothers making decisions based on the WIC package changing at 6 months? And you know, sort of what kind of modifiable factors are there that are influencing mothers' decisions to exclusively breastfeed? Next slide. Another very interesting finding, we asked about introduction of first formula. Only 9% of mothers never gave formula, so 91% did give some formula at some point. And most of these were really giving them very early in life. So 60% gave formula within the first few days, and 43% gave formula before leaving the hospital. 18% at the first feed. So these numbers are very high, much higher than national averages and much higher than Healthy People 2020 goals. And definitely worth looking into the reasons and what we can do about that. Next slide. So this just sort of demonstrates that in more visually that really most of that formula that moms are giving is right in those first few days of life, and gives us a real opportunity to make improvements there. Next slide. We asked about vitamin D supplementation as well. Very low rates of vitamin D supplementation. As most of you know, all breastfed babies should be receiving 400 international units a day of vitamin D, and partially breastfed babies who are receiving less than 32 ounces a day of formula should also be receiving vitamin D. So we had only 27% of our infants who were receiving vitamin D at all, of exclusively breastfed infants, only 14% were receiving it daily, which is very low. Next slide. So from our study, we really came up with 4 sort of major conclusions and recommendations. You know, so a very high number of our babies are receiving formula very early in life, which really removes a great opportunity for them to receive those very early benefits of exclusive breast milk in its first few days of life for the immune system and gut maturation, etc. We did a regression analysis and found that women who are setting breastfeeding goals have longer duration and exclusivity of breastfeeding. The longer the goals, the better that they're doing. We also, this is some suggestion from our work that what breastfeeding packages may influence breastfeeding exclusivity. Obviously, as I talked about, vitamin D supplementation is not being routinely recommended. Vitamin D intake is low. Next slide. So based on that, we started to this is really kind of informing what we're doing in our community. So our team has put together vitamin D supplementation educational materials, which does not exist now in our state before this. So we're lucky to have Dr. Gallo on our team, who's one of the world's leading experts actually on vitamin D, and put together this package, which is supposed to go to both with mothers and the providers in our community who have not have shown in our study also really are not fully up to speed with the recommendations. And actually, I just found out right before this webinar, this was approved by the state WIC director, so it's going to be a state WIC document. Next slide. We also put together a certified lactation counselor training, which all of our WIC breastfeeding peer counselors and breastfeeding coordinator and some of our nutritionists are attending. Actually, today is the last day of the training, and there's Jennifer on the left. She's heading up organizing this class. We have 65 people from around the country, and actually one person came in from Japan for this this class. So it's a nice group. Next slide. Just real quick, this is kind of my favorite project right now that we just rolled out as well. We did a campaign to increase water intake in the preschool age group. So we worked with the Head Start leadership in our community. There's 400 Head Start kids in our county, in our county schools. And we developed a storybook. There's me reading the storybook. A campaign based around this guy, Captain Hydro. You can see him, the penguin there. We do a song with it and dancing with the kids. And then actually with another grant, we bought these water bottles, which we distributed to all 400 kids, and sort of changing the culture of health in these classrooms. So we had them switch out their juice for water and integrating water into all parts of their day. Next slide. So just a few thoughts based on my experience for provider engagement, sustainability. I think that there's great benefits for the coalition and for this community-based project. Providers bring clinical expertise and perspective to these projects. They often have an influence in the community to help move forward the objectives of the coalition and bring scientific expertise with interpreting health literature and implementing best practice. Next slide. As far as community physicians being involved, I think there's great benefit to them as well. They can receive hands-on experience in the community and really take them back to their practices and share them with the medical community at large, and really create some nice long-term bridges and referral networks between the community and clinicians. Barriers to this obviously is time and money. I think particularly in small practices, physicians are so pressed for time that it's difficult to carve out time to engage in these projects. But I think opportunities for this, is really sort of changing the culture that there is a culture of community engagement within the physician community, and I think there's some work to be done there. And I think funding can certainly help with that. If they can take time out of their schedules and be compensated for it, I think they're more likely to engage. Next slide. As far as institutional physicians, so in academic centers, hospital systems, or governments such as myself, the benefits, I think, is that there's really a great opportunity for impact in these ongoing community-based coalitions. So, for Dr. Gallo, certainly on our team, and myself, we are really able to work with a fantastic community and really make an impact, which is what while we wake up in the morning. So I think this is a great opportunity for us to be able to do that. And barriers, again, are time and money. Opportunities, I think, these long-term partnerships that we have created over the last several years to really retain and train this well-trained leadership team for the coalition. So for our model, it's the health department, this academic group with GMU and our coalition have really built up some strong skills together and hope to continue our work together. And again, to really institutionalize physician community engagement, both culturally and also with compensated time. Next slide. Oh, that's it. Thank you very much, and happy to take your questions.
Thank you, Dr. Rethi. That concludes our presentation. If there are any questions, please feel free to ask at this time. You can either type in your question in the question box, or you can raise your hand on the webinar platform, and Natalie will unmute you and you can say your question.
So I don't see any hands up. Just for a reminder, if you have a question, just you put your hand up or type it in the bottom. We'll wait a couple more minutes.
If there are no questions at this time, we can conclude today's webinar. But if anything else pops up, please feel free to send me an email, and I can definitely relay your questions to our providers. I want to thank our guest speakers, Dr. Thompson and Dr. Rethi, for sharing your knowledge and your guidance, and also all of you for your participation on this webinar, and I hope you all have a great weekend.
Okay, thank you so much.
Thank you.
Thank you.
Thank you.